The physical assessment begins with an introduction between the provider and the patient. A general survey is conducted. The patient is asked what day of the week it is, their name, and where they are for orientation. When beginning with blood pressure, recommend to the patient that they should avoid smoking, drinking caffeine, or doing any strenuous exercise prior to obtaining their blood pressure. Before beginning your assessment, be sure that you are using the correct size blood pressure cuff for that patient by measuring. Have the patient sit for approximately 5 minutes prior to assessing their blood pressure. Palpate the brachial artery at the level of the antecubital crease. The patient's arm should remain at heart level for the most accurate results. This can be achieved by resting the patient's arm on the table or supporting the patient's arm yourself just above the waist. Position the bell of the stethoscope over the brachial artery at the antecubital crease. To ensure you have obtained an accurate reading, continue to deflate the cuff 10 to 20 millimeters of mercury past the last beat you hear. Deflate the cuff to 0 and repeat the process on the opposite arm. To assess for heart rate, use the pads of your middle and index finger and grab the patient's wrist at the radial artery. You should feel a pulse. Compress the radial artery and count the number of beats that you feel in 30 seconds. Multiply that number by 2 to calculate the patient's heartbeat per minute. Oral temperatures can be obtained through the use of an electronic thermometer. First, place a disposable cover over the probe of the thermometer and instruct the patient that you will place the probe under their tongue. Ask that they close their lips during the assessment. Wait 10 seconds for the thermometer to beep and record a temperature reading. Begin by inspecting the eye for lesions surrounding it. For the visual acuity exam, place the Rosenbaum chart 14 inches in front of the patient's face. Have them cover their left eye and read the smallest line they can read, and repeat this with them covering their right eye. To continue with the fundoscopic exam, have the patient look straight ahead. Place your left hand on the patient's right eyebrow ridge. Standing about 15 degrees to the right side of the patient, shine your ophthalmoscope into the right eye, noting the red reflex. With the red reflex in view, move towards the patient with the scope, stopping when your scope touches your left hand. Look through your ophthalmoscope at the back of the patient's eye and adjust the knob until the picture becomes clear. Once you have visualized the optic disc and retina, have the patient look into the light so you can visualize the rest of the patient's eye. Repeat on the other side with the ophthalmoscope in your left hand and right hand on the patient's left eyebrow ridge. To test the extraocular eye movement, stand in front of the patient. Take your index finger and hold it in front of the patient's face midline. Next, move your finger to the right, up, and down past the starting point for the side and back up to the center. Be sure to pause in between each movement. Do the same thing on the left side. To continue with the hearing test, inspect the auricle for lesions and palpate the auricle for tenderness. You want to inspect the inner ear for any lesions and the inner canal and tympanic membrane. A Weber and Rene test is also performed for conductive and sensorineural hearing loss. Continue by palpating the sinuses for tenderness. Starting with the maxillary sinus, palpate both sides, right under the eyebrows with your thumbs. Next, palpate the frontal sinuses on both sides with your thumbs under the eye lateral to the nose. For the throat and the neck, palpate for submandibular lymphadenopathy and inspect the teeth for abscesses and lesions. Now that the patient is in a gown, check for any lesions, bumps, or abnormalities. Palpate the skin for temperature with the back of your hand. Continue by inspecting the inside of the mouth for lesions, bumps, erythema, exudates, or abscesses. Palpate the thyroid from the front of the patient, feeling for all landmarks. Palpate the thyroid from behind the patient and ask them to swallow. To continue with the heart exam, palpate the carotid arteries for thrills and auscultate for bruits. Auscultate the heart. First, inspect the carotids for pulsations. Next, take your index finger and middle finger and palpate the carotid arteries on both sides of the neck, one at a time. Lastly, listen with the bell of your stethoscope over the carotid arteries in turn for any bruits. When auscultating the heart, the patient remains lying down at the bed with 30 degrees. Start by listening at the right side second intercostal space. Then the left side second intercostal space, left third, fourth, left fifth, and sixth intercostal space mid-axillary line where the PMI is located. For the sensory exam of upper and lower extremities, assess muscle tone by feeling the patient's extremities, then assess grip strength. For reflexes, check the biceps, triceps, brachioradialis, patellar, Achilles, plantar reflexes bilaterally. Cranial nerves 2 through 4 have previously been tested in our eye exam, so we will begin with cranial nerve 5. Begin with the corneal reflex exam. Next, continue with the sensory component with the trigeminal nerve by brushing the cotton ball over the face when she is expecting it. Then ask the patient to close her eyes and brush the cotton ball on 6 spots of the patient's face and ask the patient if she feels sensation of the cotton ball. Then test for pain sensation by intermittently using the tip of a cotton applicator versus the wooden stick. Ask the patient if she feels sharp or dull and if they feel the same on each side. To test for the 7th cranial nerve, inspect the patient's face at rest for asymmetry and facial weakness. Ask the patient to raise eyebrows, close their eyes, blow out their cheeks, and purse their lips and close their lips.